Hi, welcome. I've seen your messages and I want to tell you that you are literally wasting your time. Again and again, I'm telling literally wasting your time watching YouTube videos and wasting your time and energy in negative thought, unwanted things, stress, anxiety, all these things. So, first thing I want to tell you that take that into your mind. That's most important thing. Okay, think like you're writing almost 160 questions. You're confident with that and you are getting a good rank and you are taking admission in a good college. Take that event into your mind, then everything will follow after that. Okay, just do what I said right now. It will really going to help you. Okay, that's the first thing. Second part about GTs, about the PYQs, about your studies, about the FOMO, fear of missing of part or something. I want to tell you that whatever you're following right now, just do it because it's the last 3 weeks. So don't change anything, don't do anything new, don't listen to anybody. Whatever you are doing right now, just continue with more genuinity and more dedication and do it extra. Every day, try to do little bit more time, spend more time in studies. That's the only thing I want to tell you. And also, use the time wisely. This is the thing that you need to understand. Okay. And the second thing I want to tell you about can you imagine that a small ant can destroy a laptop? Yep, it can. It has happened to me uh, last day. So that's about life. Everything is not so predictable. Anything can happen at any moment of life. So that's what I want to tell you, that keep faith, go through this phase, do your best. That's it. And the result and everything is just part of you know not 100 percentage in your hand. Of course, 80 percentage of the results come from your hard work and 20 percentage is luck, faith, whatever thing you call. So I want to tell you one more thing. Next 3 weeks is equal to your next 13 years or 15 or 16 years. So you need to understand that part very well, and do it, use it very well. Next 3 week you have to use it like you have to what to say, you have to prove yourself that you are not you're not going to regret later. You're not going to sad about you're wasting your time now, because you see, after these 3 weeks you get a plenty of time to do whatever you want. You can go to Thailand, or you can go to some place, Kashmir, or you can go to some temples, or wherever you can go after this exam, because that much time you will get it. Definitely you will get it. NMC will not do the admission at the current timetable which was given. I'm telling you that after this you will get plenty of time. You can work, you can do whatever you want after this exam. But these 3 weeks, use it. Use it like use it like what to say, use it like you never did before. Then you can get a good rank, you can get admission in very good college, and you can have a very nice life, and you can make your parents proud. That's the most important thing, right? Whatever you're doing, that you need to you can make your parents proud, your friends proud, your college proud. That's the that's what the true happiness, true things about it. So I want to tell you one more thing at this point is that avoid asking question at this time, because it's almost 3 weeks ahead. Even if you start something new, it's going to damage your score. That's it. Whatever you're doing right now, do it. Even if you're getting a GT score 150, around 150 only, try it again. Like, revise. You don't need to ask anybody to how to get more GT, how to do that thing. It's all about you. See, everyone going through different path. It's all about, see, the exam is not just about your memory or markup stuff. Not like that. Your experience, most of this, if you ask me, like from the ortho, the most of the case is directly from your experience in your internship or your GR ships. So in such a case, if you do an anesthesia JR shape, it's going to be easy for you to you can take 100% question in anesthesia if you do JR shape, because in my experience I can easily crack all these anesthesia questions, because I used to work there as a JR. So you cannot ask someone to help you, because everyone having different level of experience, different level of study capabilities, abilities and all. So all you need to do right now, don't ask any question. What you need to do, revise again, revise, and avoid all these negative thoughts in your mind. Because if you see, the negative thoughts will only till the exam. You will understand that after your exam you will wonder like, where was it, my stress, my I may miss that one, I may miss. When you are at the exam hall, and you will understand that everything from the pyq, everything from the pyq topics only. And the most important part is you don't need to confuse at that time. That's what I'm saying, the mnemonics is most important thing at this point. Whatever you are doing right now, make mnemonics. That's very important, so you won't forget things, especially you won't confuse between A and B. Okay, so that's the most important thing you need to understand right now. And also the real-time exams. Right now the pattern changed. That is a 40, 40, 40. Some new sections came up there. So I know that the Marrow having the same thing. So if you ask me which is the best platform to do that, I'll recommend you Marrow, because the pattern, whatever the NMC going to do right now, the Neet PG newest pattern, they are following in Marrow. So if you want, you can try that at least once, so you will understand that you won't be surprised at the exam hall. At least you can have a prior what to say, a experience to it. Okay, and the next part is very honestly speaking, this time is like, last 3 weeks is like hell. You may have a sleepless night, you have a lot of stress and all. So with that, see, stress and this kind of things are good, but it should not be more than the limit. So that's what I'm saying. You need to do meditations, you need to eat less. It's very important at this point. I'm telling you that most of the guys who are eating, having foodie type, avoid fat, avoid the meat meals and all. Not, it's not a joking part. When I was prepared, there was my friend there. He used to go out, take biryanis and heavy lunch, and he go to sleep. So this is scenario there. So avoid heavy meals. So that will help you to focus more and having stress free in these days. And also one more thing that I want to tell you, that keep doing PYQ. Even if you are a guy who's going to start today, start with PYQs. PYQ, especially last 10 years, you can easily available. It's quite easily available in YouTube or Telegram groups. Go through all the PYQs, and if you got extra time, go through that topic too. Get some knowledge in that. If you ask me, like for forensic, the most thing they will ask in forensic is like, first is the IPC 84, 321. 475. These are the common questions they will ask, and the technique which is used in the forensic en mass, like all the thing, all the organs, everything will take out and examine, right? And also the body was suppose the body having high temperature, which means what? It's a very typical question which is asked multiple times in years. The one reason which is septicemia, that you have an infection, then the temperature eventually it's quite normal to increase, right? Exactly like that. So also some poisonous, physiostigmine, datura, atropine, all these things are quite what to say, common in exams. So you need to understand these topics. Once you understand these topics and you go doing your PYQ, you doing your GT, you can definitely you can score more than 160. Not an quite hard part. And also I got one question which is really surprising, that sir, I didn't study that non-clinical subject. I'm telling you, I'm just if you ask your seniors or anybody, they will tell you that, see, the non-clinical subject are the one you can take, you can get 100% mark. It's not like if you go to medicine, if you go to surgery, OBG, or even in ortho, some questions are like application level, something which is very high level. Some questions are from the DM type questions they will ask. when that place is maybe some confusion, somebody can really get the answer, but I'm telling that this will, like, it will give a lot of time to consume time also. It's like you will be in a confused state between A and B, something like that. But in non-clinical, it's not like that. They will ask you direct question. Even in the pharmacology, they will ask the mechanism of action or whatever things will directly will come, right? So these are the things you need to understand at this point. I'm not going to make it more complicated. So focus. All you need to do PYQ, GT, revise, and stress free. Please don't be stressed. There's no use of being stressed in this time. You need to take a small meditation for 10 or 20 minutes in one or two times in a day, and enjoy your process of studying at this point, because just 3 weeks you will, exam will end, and after that you can enjoy your life. You can go and take shawarma, biryani, or whatever thing, or ice creams, or you can go for trip, or you can go whatever you're doing with bungee jumping or whatever thing. But these 3 weeks, make yourself, you're going to work hard, sacrifice everything, then you will get it. And I know I'm personally not messaging your queries or questions. I will do that today because I was a bit busy with yesterday stuff and all. I want to tell you one more thing, that please make sure that you are aiming some subject, the branch, and you are going to take it or work it till you get it. That's, you should make sure. That's also very important in your life. Okay, don't sacrifice your seat for anything. It's not going to be work for you, your life, or anything. Okay, thank you so much. Study well, guys. You can do it. Trust me, you can do it. Only thing you need to do that your stress, your anxiety, all the FOMO things, everything, just leave it away. Whatever you're doing right now, do it with more hard work and genuinely, and put more extra work into it. And most important thing I'm telling again is PYQ. Seriously, PYQ is most important, because if you do only PYQ, you will get around 60-80%, and also GTs, and you have to know very well these things. Okay, and also some questions were, how many hours do we need to study? I'll tell you one thing: if you study 2 hours and daydreaming, there's no use. If you study 20 hours again with daydreaming, nothing will happen. If you study 8 to 10 hours or 8 to 15 hours efficiently per day, it's really going to help you. And also consistency is really important. If you're studying 2 days in a week and next 3 days you are doing something else, it will not work. It will not work means it will not going to give you good result. Maybe in some extraordinary people can do it, but most of, I'm telling you about 80-90% of the people's normal kids situation, that you need to have a consistency. At least if you are studying 4-5 hours per day, but you have to do consistency, like continuously just study that, and keep revise. That's the most important thing. Revise, PYQ, and the consistency, and study well. That's it. And sleep well too, because last when you're going nearby to the exam, there's a issue with your sleeping pattern. So don't change your sleeping pattern at now, and also sleep well. Okay, that's the most important thing. All the best, guys. So I hope everyone will get your dream branches. Okay, thank you.